Hello and welcome to our show. I'm Lana Kay, and we have another informative program targeting seniors, people 50 plus. According to the World Health Organization, a majority of the diseases that older people suffer are, guess what, a direct result of nutritional deficiencies. Here with us today, of BenchMark Physical Therapy is Leigh Wagner. Lee's back with us today, and I'm so glad you could come. Leigh did a previous show. She's a physical therapist with, of course, BenchMark Physical Therapy located in Union. And today, though, we'll be discussing nutrition. So, Leigh, what complications can arise from these deficiencies? What are we looking to avoid?
I was going to say, just to start off, like nutritional problems that the elderly often face include like a weakened immune system, lowered energy levels, chronic health problems such as type 2 diabetes, high blood pressure, heart disease, and osteoporosis. So really the fat that is in food is directly linked to prostate, colon, and pancreas cancer. And also that osteoporosis and diabetes is directly linked to the lack of macronutrients that we are not getting in our diet. So what age-related challenges hinder our proper nutrition? There's a lot of them, but I want to talk about those, but then go into like how we can find the nutrients we need in our food.
Right.
So those hindering things that we often come across, especially as we get older, is the decreased sensitivity. That decreased sensitivity to smell and to taste. So, you know, if we don't smell things, if we don't taste things, well, we just don't feel like eating. And then also the recognition of salt. So if we can't get that salty taste in our mouth, then we actually oversalt things.
We keep sprinkling.
Yes, which then leads to that increase in our high blood pressure. So that puts us at risk for heart disease.
Wow.
And then also, we don't lose the taste of sweet. So guess what? We love to continue to eat our sweets.
And is that right? So while we lose salt and smell and taste, not sweets.
No, we still love our sweets. So that's where we can increase those pounds. So we got to watch that. Sure. Also, medication side effects. You know, we're taking more medications as we get older, and those medication side effects can lead us to a reduced appetite, decreased food appreciation, and cause nausea. So, you know, that leads us to problems with our health in general. Mm-hmm. Poor dental health. We have missing teeth, gum disease, poor chewing, mouth sores, ill-fitting dentures. All that can lead us to having problems with getting the nutrients that we need.
Sure.
Then lack of finances. Once we retire, everybody's living on a fixed income, and that fixed income greatly affects what we are able to buy, and that is directly goes to the grocery store. And
I hear so much about that organic versus non-organic. You know, I can't afford the organic. I hear so many seniors say, I would like to do better, but that would impact it.
And even the fresh fruits and vegetables, those are more expensive. And really,
True.
when you're living on a fixed budget, that's hard to do.
Yes.
Lack of transportation. If you can't get to the grocery store, how are you going to be able to make those healthy choices?
True.
Physical difficulties, you know, arthritis, other disabilities can cause that senior to have trouble moving, cooking, shopping. All this leads that person to maybe not preparing that healthy meal, then choosing those unhealthy alternatives, so that, again, we're going down the path of unhealthiness. Mm-hmm. And then also memory loss, so Alzheimer's, dementia, might make that person forget to eat, which, again, leads them to those poor choices. Depression. Anyone who has depression, you're not going to eat, or you're going to overeat and make those bad choices. So it's a catch-22. And then as we get older, we don't need as many calories as we did when we were younger. For example, a woman who's over 50 years of age actually only needs 1,600 calories a day if she's sedentary.
Is that right?
That's right.
That's low,
That's
Leigh.
super low. And so you can get the dietary guidelines for Americans, which is published in 2015 for all the different guidelines for each age group. But that's just an example of one of them.
Mm-hmm.
And then also chronic medical conditions, so can lead to poor nutrition, like high blood pressure, high lipids, glucose intolerance. Atherosclerosis can put a person at risk for those strokes, osteoporosis, and diabetes. I mean,
Gosh, Leigh.
I know. I mean, these are, when we're younger, we don't have these problems.
We don't think about those things.
But these are the complications, external factors and the internal factors that
of the aging
process. And then also that weakened immune system, which person with a weakened immune system is more susceptible to getting bloodborne pathogens and foodborne illnesses. So they have to make sure that those foods are properly cooked. So again, making sure that that poultry is cooked and cleaned so that they're not getting sick.
Mm-hmm.
So what should that we be eating?
This is the main thing.
This is the main bulk of it all.
We need to listen carefully.
Yes. So according to most senior nutrition guidelines, the easiest way to get all the necessary nutrients in your body is to have a highly diversified diet containing complex, non-refined carbohydrates, lean proteins, low-fat dairy products, and foods low in saturated and high in unsaturated fats.
Correct.
So, and then my biggest tip is eat 5 small meals a day instead of 3 large meals a day, which will keep your metabolism boosted, so that keeps you from having, like, putting on that weight. Because
it helps you burn. And, you know, I think people have a tough time with that, Leigh, because they think, you know, they starve practically until dinner,
right,
and then gorge, and then soon you'll be going to bed. I think people have a hard time, you know, getting that through their head, that the 5 smalls are so, because we keep burning.
Yeah.
As food enters, we're going to burn.
Exactly.
So that's a great tip.
And then it just keeps you going, and like you also don't need as much. So then if you're eating those small meals, it actually keeps your stomach smaller, so you're not stretching out your stomach, and then it makes your stomach, when it's empty, feel that much hungrier.
Right. And I've heard so many older people say, I don't eat what I used to.
Right.
I don't think they need it anymore, you know.
Right. So what are the 14 nutrients that you should find in your diet that you should be looking for in the foods that you're eating? So first one is those carbohydrates. And these are the main source of the energy that should account for 50% of the caloric intake that you take in every single day.
Is that right? It's up to half?
It is.
Wow.
But
I'm surprised.
Yeah, but we're not looking at those bad carbohydrates. We're looking
that's the problem. Okay,
we're looking at the
gotcha.
good carbohydrates, like your sweet potatoes, your brown rice, your whole grains.
Mm-hmm.
So those are what you're looking for. You don't want to look at those empty carbs. You want to look at the good carbs of things. And then the next is your proteins, which are proteins coupled with exercise are the most important nutrients for maintaining your muscle and your strength. So that's really important for avoiding frailty as you get older. Mm-hmm. And that frailty, if you're frail, is at a high risk for falls, and we don't want that.
So Leigh, so stop right there and give us some good protein. Eggs, I mean, what
eggs
do you think are good?
Chicken, salmon, beans. So those are your big bulky ones that you really want to look at, and they're lean proteins.
Okay.
And that's what I always tell people, like, to go after.
Okay.
And they're pretty easy, and you'll find that you're going to see beans later on, you're going to see salmon later on for other nutrients that you're going to need in your diet.
Right.
Just an FYI.
Right.
Then the other ones, the big ones that everybody knows that they're supposed to eat, but most people don't like to eat, are your fruits and your vegetables. And the recommended daily is 5 servings a day. Now here's something that I don't think most people know. That by increasing your consumption of fruits and vegetables by 1 or 2 servings a day could cut down your cardiovascular risk by 30%.
Oh, that's a great statistic. That will encourage us. That's
Yeah.
great.
Yeah,
30%.
30%. That's huge.
That is huge.
So
Great tip.
really encourages you to eat those fruits and vegetables. And you're going to see later on where I'm making suggestions of what kinds of fruits and vegetables to get these nutrients in there. Now, we'll get into like some of the nitty-gritty of things. Those omega-3 fatty acids, you've heard about them written on packages of things. Why are omega-3 fatty acids so important? They actually help prevent inflammation, which can cause cancer, rheumatoid arthritis, heart disease. It actually prevents or slow down macular degeneration for your vision, reduces your risk for Alzheimer's. And the recommendation is to have 2 servings per week of omega-3 fatty acids.
Omega-3, and that's not much. You know, we really need to eat 2 servings a week to prevent those horrific conditions.
Yeah, pretty easy. And omega-3 fatty acids are found in your fishes like mackerel, salmon, I told you about salmon earlier, sardines, tuna, in your nuts like pecans, walnuts, pumpkin seeds. And if you're cooking in your olive oil, soybeans, your eggs, we talked about eggs for proteins, spinach for your vegetables, your Brussels sprouts. So just putting those things in there. And now for calcium, which is really important for your healthy bones, for that frailty, and also is important for lowering your blood pressure. So it goes hand in hand. And calcium-rich foods are your dairy products, which we all usually know about, so your milks, your yogurts, your cheeses. But also calcium is found in your leafy green vegetables. And these days, they fortify our cereals. So you can get calcium in the fortified cereals that you purchase, which is good. And the WHO recommends that people 50 years plus get 1,200 milligrams of calcium daily, which that is about 4 cups of fortified orange juice, milk, soy milk, or almond milk. So, I mean,
those are the choices in 4 cups a day of any of those.
Yeah, that was the example they gave us.
Not bad.
No, not too bad at all. Yeah. And now fiber. The reason why fiber is so important is it promotes your digestion, which digestion is important to get the excess toxins out of your body, to keep your digestion system flowing well. And also it reduces your risk for heart disease. Again, you don't think about that, but it does help with that heart disease. And it also helps with your cholesterol levels. So heart disease and cholesterol. So fiber is actually really important.
To flush.
Yes. And the fiber-rich foods are your nuts, again, your whole grain cereals, your whole grain breads, your whole grain pastas, your brown rices, your brown breads, your fruits and your vegetables. Trust me, fruits and vegetables are very, very fibrous.
Oh, good to know.
Very good to know.
Okay.
Your beans, your lentils, your oats, and your oat brands. So I always think brown, and it's probably fibrous. Or if it came from a tree or the earth, it's probably very fibrous.
Great tip. Great tip.
And then another thing we don't think about that's a nutrient is actually water. And water is so important for us. Drinking 8 glasses of water today is just as important as physical activity in the maintenance of our health. And that's 8 glasses of water a day.
Whether you like it or not.
Whether you like it or not. And I know that as the elderly, they reduce their ability to conserve water. So that's even more important.
It does make it more important.
And I know with a lot of the medicines we take, you have to go to the bathroom more, but it's still just as important to drink water.
8 glasses.
Yes. Also that overactive bladder, but medications and chronic medical conditions also increase your risk for dehydration. So you're running that risk for dehydration, and complications of dehydration are constipation, headaches, dizziness, low blood pressure, rapid heartbeat, loss of consciousness, seizures, kidney failure, and swelling of the brain.
Wow.
So some are minor, but some of them are really major.
Yes. Whoa.
And water's
food for thought.
Water's pretty simple.
Okay,
it is. I mean, and it's free.
That's true.
It is pretty free.
True.
So another important nutrient is iron. And iron is important for preventing anemia and lethargy, so actually being tired. And iron is found in your eggs, your red meats, your liver, your oysters, your mussels, your clams, your chickpeas, your fortified breakfast cereals, your soybeans, your black beans, your lentils, your spinach. So again, you don't need a lot of iron, but it's still important. So usually if you're going to eat your eggs or you're going to eat your fortified cereals for your other needs, like you
might be getting it.
You're going to get it and you need it anyhow.
That's a great tip.
And so then your vitamin C. Your vitamin C, which we all know is very important for the antioxidant properties, which can help prevent cancer and heart disease. Also, it helps produce collagen, which gives your skin elasticity. It helps with bone repair. If you ever had an injury or broke a bone, helps with maintaining your teeth health.
Wow.
It also helps.
It does a lot.
It does. Vitamin C, it helps with wound healing. So if you had to have a surgery and you need to recover from a surgery.
You want to make sure.
And then if you get sick, it helps you recover get through that sickness. So vitamin C, it's huge.
Yes.
It's huge. And besides taking that supplement of vitamin C is found in your citric fruits. So your oranges and your grapefruits. But it's also found in peppers.
Peppers?
I know. Kind of weird, but peppers.
Peppers, good. Great.
And then your vitamin D, another vitamin, which also aids in the absorption of calcium. So to get that calcium in, you need vitamin D. So they kind of couple themselves together, which vitamin D slows the loss of bone loss. So we don't want our bones to become brittle, and it slows it down.
Most elderly or older people, not elderly, older, I think do take a vitamin D supplement. Most doctors will tell you.
100% they do.
We've got to get you on the vitamin D.
Yeah, they usually give you a supplement, but the thing is vitamin D, you get vitamin D by being outside in the sun.
Yes.
Yes. You get it naturally from being in the sun.
Maybe 20 minutes a day, is it?
I think it is 20 minutes.
Like
so it's you don't need a lot of it. And the other thing is vitamin D deficiency increases your chance for falling, just an FYI.
Wow.
And then, but also vitamin D is found in your fortified cereals. So, I think the best thing they ever did was fortify those cereals. Your milks, your yogurt, your juices, because remember those juices are fortified as well. Eggs, salmon, tuna.
Again, we're going that route.
We're going that route, and you can see, that's why I wanted
how much it's helping us with different
things. So you can, when you go to the grocery store, you can be like, what's the best thing I can buy? What's the most bang for my buck? And now you can be like, okay, let me steer towards these things, and I can get the best thing for them.
Oh, great information, Leigh.
Then the vitamin B12. And B12 is responsible for maintaining your nerve function, production of red blood cells, your DNA, and again, found in your dairy products, your meats, and your poultries.
Okay.
And then your potassium. Potassium is really important for your cell function. Reduces your blood pressure, lowers your chances for kidney stones, and they recommend about 4,700 milligrams daily. And potassium-rich foods are your bananas, your prunes, and your potatoes.
Bananas, prunes, potatoes.
And most people know for potassium, it's bananas.
I know.
Yep, everybody knows.
Everybody knows. Most older people in the grocery, they've got their bunch of bananas. Right in the top of the cart.
Which gets your fruit, your daily serving of fruit.
True, good.
And then your magnesium. And your magnesium actually plays a vital role in 300 physiological processes inside your body, and is also important for your heart health and bone strength and our immune system. So magnesium is important. It's one of those nutrients that's important. It is harder to absorb as we get older, so it is important to find in our daily nutrients of food consumption, and it's found in our whole grains, our nuts, our fruits, and our vegetables. So
Fruits,
important,
vegetables. Yeah,
important to get those.
I know that's a very, very important factor is magnesium, and many people take a supplement, including me.
Of magnesium, absolutely.
Yes.
And then the final one I like to hit on is the collagen. Collagen is really important for your skin, your hair, your cartilage, and any other connective tissue in your body. And it helps also prevent arthritis. So,
Oh,
yeah.
I did not know that.
And that collagen is found in bone broth, chicken, beef, eggs, fruits, vegetables, and nuts.
Here we go with the eggs again. So we're getting, yeah, if we're thinking, you know, like she said, you know, if you think of the things one food choice can give us, that really puts it up there.
Right, and eggs are not that expensive. Fortified cereals are not that
That's
expensive.
true.
And then you put
This is
the
true.
milk onto the cereal. You know, you're getting those. And milk, again, it has, I mean, like back in the day it was a lot cheaper, but it's still, again,
It's still not
that
bad,
expensive.
not
And it
bad.
lasts forever.
True.
Now. So it's like looking at what is the best things I can buy to get all the nutrients that I need. And that's where you got to look at the big picture of things. And so some of the take-home points I like to tell people is avoid those empty calories. These foods with a lot of calories but few nutrients, such as chips, candy, baked goods, soda, and alcohol,
No.
they're not worth it. They're not going to give you anything. They're only going to add pounds on your body and give you nothing back in return.
Whoa.
Pick foods that are low in cholesterol and fat. You want to avoid those saturated fats and those trans fats. You usually find those in those fried foods and those fast foods. So again,
It's not worth it.
It's not. They're
not
good.
worth it.
I mean, it's good to have, like they say, a cheat meal. But you really want to take your time and go to the grocery store and pick out those foods that are going to be good for you all the way around. And the other tip I have for people is go to the doctor once a year, have them do the blood work, have them go over your blood work with you to look at where you're having some of those deficiencies.
You know, Leigh, sometimes when I go for that annual physical, he does blood work, but it's like, you know, my lipids and all this. Should we ask for a vitamin also? I don't think my doctor does that.
You can ask for it, and it's hidden in there, and I stress it with them because you can be deficient in things, and that's where then they recommend the supplements. And supplements are good, but supplements can also be expensive.
True.
And that's why I say to
people,
people,
watch cost.
and that's why I say to people, like, you can find all these things in your diet. Like,
this was some great information.
And getting these foods is actually cheaper than the supplements sometimes. But sometimes you do need to take the supplements, like you said.
If you would be very low, yeah.
Then you need to take the supplement.
At least to get back up, and then
up.
maybe concentrate, because food is better than supplements.
It absolutely
Natural
is.
food is better. You know,
Yes.
people don't really understand that now. We're kind of turned into a supplement world, but
Right, or like, let me take a protein shake.
Right.
And that's not as good as the real food.
as salmon and, you know, the things that you mentioned before.
But again, it's all better than not having any of it at all.
That's right. That's right. Well, Leigh, thank you for another informative show. You've given us so many great tips today, given us so much food for thought, get the pun. You've been listening to Leigh Wagner, BenchMark Physical Therapy. Leigh is a physical therapist there. Don't forget that. And her contact information will follow. And if you took notes today, great, because you can't beat her for knowing her stuff. And good luck in following your new lifestyle. And Lana Kay is signing off. Be happy and keep smiling, and I'll see you soon.